And the essence for you sitting here today is to help the general public, be aware of the importance of this day. So to start the conversation with first, let us talk about when we say the World Oral Health Day. When we say the World Oral Health Day, what is that day all about? What is the essence of the day? This is your department. This is what you people do. Why did the World Health Organization come out to say 20th of March every year there should be a World Oral Health Day?
Okay. It's been a day that has been set aside by the World Health
Organization,
Organization
yes.
to sensitize the global population about the importance of your oral health.
Mm,
Like we all know, the oral health is the gateway to the body.
mm,
So anything happening in the body pictures in the mouth. And once your mouth is healthy, it's a good indicator that definitely, all round you're in good condition.
mm. So the World Health Organization felt that it is a necessity for us to be aware of the oral health. This will bring me to my next question, Dr. Mujisola, that aside the fact that we know that we have to brush our teeth every morning and then we brush at night, right? Is that not the so-called oral health? Is there more to oral health aside brush your teeth in the morning, brush your teeth at night?
Yes, there's more to it than that. Brushing is just the basic,
Mm,
but there's a lot more to it. When you brush your teeth, that is like the baseline.
mm.
Yes. And brushing, we preach brushing because a healthy mouth, for this year, the theme is a healthy mouth is a healthy mind.
A healthy mouth is
Yes.
a healthy mind.
Yes.
Mm.
So that shows you the importance of having a clean mouth. Brushing makes your teeth healthy.
Mm.
It helps you to enjoy your food better. And by enjoying your food better, you make healthier choices.
Mm.
Yes, and making healthier choices ultimately translates to having a healthier lifestyle.
But is that to say that belief or assumption that we used to have while growing up, where they would tell us that if you eat before brushing your teeth, you enjoy the meal well, you get all the taste. But if you brush your teeth, you are tasting different kind of.
I think that's a myth.
Mm.
Eating before brushing, unless you have brushed the night before, if you're talking about breakfast.
Aha.
Yes, once you've brushed the night before, definitely overnight, you haven't taken anything.
Mm.
And that, your brushing has reduced the oral flora. That's the bacteria present in the mouth.
Mm.
So when you eat in the morning, your mouth is lighter, you're able to taste the food better.
Mm.
But if you don't brush at night and you eat in the morning, I don't know, your mouth feels kind of heavy.
Mm.
I'm sure you agree with me on
True,
that.
true.
And that's because of the presence of the action of all the bacteria in the mouth.
Mm.
And even the odor that comes out from your mouth is not something most people like. So it's better you brush at night so that in the morning, if you're in a hurry, you can have your quick breakfast and then brush later. But if you are not the type that brushes at night, please brush before your breakfast in the morning.
Yeah, we have so many things to talk about, like I told you. We would even talk down to the point of our toothbrush. Right? Some will tell you that so far the toothbrush is not breaking apart and is still useful. Why do I need to change? But a dentist will tell you that after 3 months you should change your brush. There are a lot of assumptions, fallacies, myths, thoughts in the mind of people that you help us clear
Yes.
and understand today. Before we get to that part, when we talk about the health, it encompasses a lot. We have the mental health, we have the general health. Now we are talking about the oral health. What is the relationship with the oral health and the general health? Does the oral health has any role to play with the general health?
Definitely, yes.
Mm.
Our body is all connected, is intertwined.
Mm.
Yes, because there are even some bacteria in the mouth, which if you don't control, it can give you some systemic infections like the heart.
Mm.
Yes. For people who have maybe prostheses in the heart, like heart,
Sorry.
yes, that have valves in their hearts.
Mm.
Before any dental procedure, they have to take some precautions.
Mm.
Yes, because if you don't do that, the blood flows all around the body, and by that, you can have bacteria flowing from the mouth, goes into the bloodstream, and you have it rampaging all over the body. So
Mm.
that's why your mouth should be clean at all times.
So let's look at the fact that some persons will just say, "Oh, you're saying that because you're a medical practitioner. You're saying that because you are a doctor. I don't really brush my teeth twice a day. I don't even brush, maybe I do that once in a week and I am fine. Can we look at some of the dangers? Can we look at the problems, if that is the right word to use, if your oral health is not properly taken care of? How bad can it be? What are the dangers in line with poor oral health care?
Okay. If your oral health is not properly taken care of,
Mm,
it leads to a variety of things. The most popular around us is pain and abscess, that's swelling. And
mm,
that's usually what prompts people to come to the dental clinic. But we shouldn't wait until then. We should make it a habit of
mm.
having a check at least twice in a year.
At least twice in a year.
Yes, that is every 6 months. Don't wait until it's symptomatic. You can't
Mm,
sleep, you can't eat. That's when you come, and then you come with cotton wool in your
mm,
ear because
mm,
it's that bad. You're not able to sleep. You come. No, you shouldn't wait till that. And then for babies, as soon as the first tooth erupts in the mouth,
mm,
it's a time for them to come to the dental clinic. Even if it's just for familiarization. There's this myth about the dental clinic and pain. So,
mm,
children, once they come, at the sight of you, they're already screaming and yelling. But if they're already familiar with such environments at an early age, they are more comfortable having dental checkups.
mm,
And, regular dental checkups helps you to keep your teeth for as long as possible. There's also this myth that as you grow older, your teeth are bound to fall off. It
mm.
is not true.
It's not true.
Yes, if you take good care of your teeth, they're going
Mm,
to last you for as long as God wants it to.
mm,
Yes, it's just the carelessness around us. And then associated with the fact that as we grow older, there are some certain medical conditions
mm,
which also sets in. And like I said, the mouth mirrors what goes on in the body.
mm,
Yes. So for cases like, I'm just taking an example, like diabetes. If you're diabetic and you're not controlling it properly, it's going to show in your mouth.
mm,
You're going to have multiple mobile teeth. You can have abscesses which will not heal in time.
mm,
And once your teeth are mobile and you still don't take good care of it, they
mm,
start to fall off one at a time. And
mm.
then some will just be like that, it's because I'm already old.
Exactly.
Yeah, no, you can do better than that.
Mm.
Don't wait until your teeth fall off, because the price you pay when it's off is more than what you do to prevent such cases.
I like the fact that you've made clarifications and you've allowed people understand that at least in a year you visit your dentist twice, which is 6 months, and then the next 6 months of the year. Having said that, you have started the whole meat thing. Let's take a look at some of the meats. This is what you do. You would have heard a lot.
Yeah.
Sometimes some will tell you that the age has to do with, when your teeth will fall off, when it will grow and all that. But you said that is just a fallacy. It is not true. What are some other myths that you have come across, you have heard in a way or the other, maybe from customers or clients? I don't know what you call them.
Okay. Another popular one is children born with teeth.
Mm,
They believe, this kind of child must be a special child.
mm.
Or this kind of child, please don't offend them so that they don't say any negative thing to you.
True. Mm.
But from what we've learned, it's just an early eruption.
It's not a special or a big
Is
deal.
no, it's not. It's
Mm.
just an early eruption of the tooth into the mouth. And most times that tooth that you see is what the baby is going to use till about 6 years before
Wow.
it now falls off and then the permanent one comes in.
Mm.
So mothers with such children should feel free, because you see them wrapping up the child. They don't want to take the child out. They don't want people to see their children. If you make your child to grow up with such mentality,
Mm.
you are going to affect the psychology, the confidence of that child, and it
Mm.
shouldn't be. So and then that also brings us back to the fact that bring your children early enough for dental consultation,
Mm.
because if you bring such a child, will boost your confidence that this is something normal, even though not so common.
Mm.
So,
It is normal, even though
yes,
not so common.
Yes,
Mm.
yes. So the few cases, don't be scared. There's
Mm.
something, is something that we are familiar with.
Mm.
And please don't go around trying to remove that tooth, because if you remove it, another one is not going to grow until the permanent is ready to erupt.
Mm.
Then we also have some children that are born with what we call clefts.
Okay.
That means they have opening of the lips or
Mm.
the palate.
Okay.
Yes, this also has a lot of etiological factors. That means what causes it. But there's a solution to it as well.
Okay.
So if you have a child like that, bring them to the clinic and then we'll tell you the steps to take.
Mm.
Instead of you panicking and then keeping such children and they don't even want to send them to school because they don't want people to see them and
My next question, thank you very much for that one. My next question will be some of the problems. I have just about two or three of them here. You will still help us with more, but let's take them one after the other. One very common problem, not with everybody, but some few set of persons, will be the color of the teeth.
Okay.
Right? Some persons will tell you, I brush my teeth like twice a day, as it should be, but yet I still have this brown teeth. And comparisons to other teeth, you see this teeth is looking so whitish and so glowing and all. So when we talk about brown teeth, what is the cause for this?
Okay, thank you. Um, the way it is, your baby teeth,
Hmm.
which we call the deciduous,
Yes.
are white.
Okay.
So once those ones fall off,
Hmm.
the permanent, which is the adult teeth, are not as white as the deciduous teeth, that's your baby teeth, unless something has been done artificially to make it more aesthetically pleasing. Yes. So, parents tend to come in, especially children at mixed dentition stages. That means they still have some baby teeth and they have adult teeth in
Adult
their mouth.
teeth.
They bring this new one that is coming is not as white as the baby ones. And then you have to let them know that this is the original color of the teeth that this child is going to have. That's one. Two is we have what we call extrinsic stains. Those are
Okay.
stains that appear on the teeth as a result of what we eat or drink. For example, smokers,
Okay.
they're going to have tobacco stains on their teeth. If you are the type that takes green tea a lot, you're going to have stains on your teeth.
Green tea.
Yes.
Huh.
So you're going to have stains on your teeth. So for such, coming in twice a year, sorry, will help you. We're going to have what we call a procedure called scaling and polishing.
Okay.
That will take care of extrinsic stains. That's stains that appear on the teeth following food or drinks. Then we also have stains that we call intrinsic stains. These are stains that appear as the tooth is developing.
Okay.
So, for example, we have what we call tetracycline stains. This even happens when the tooth is still developing within the bone. Yes, it's not even in the mouth yet. And this injury can occur if maybe the mother was sick during pregnancy
Okay.
and had to take some medications that would be absorbed by the cells that are forming the teeth. So by the time the teeth now comes out later on in life, you see that probably they are not well formed. The color is somehow. For such teeth, a normal scaling and polishing will not change the color of that tooth. You need more work to be done. When I say more work, all our celebrities on TV that you see them with paper white teeth, it is artificial.
Oh, really?
Yes, most of them have done a touch-up. Yes, and we have various types. You can have your veneers, you can have your crowns. There are different forms of touch-ups that you can do to give you that perfect smile.
Talking about touch-ups, talking about artificial teeth, talking about all of this removal and fixing and all. We hear a lot. There are cases where they will tell you that these things are not very okay. They have side effects. Some will tell you that it is not as strong as the original teeth and all of that. And come to think of the fact that these things are done by medical practitioners, so to say, it is not just an unprofessional that will fix these things. For you, as a medical practitioner, that you are a renounced one at that, what's your take on this artificial teeth from the original, taking off the original for a whiter one just to stay shiny?
No, you for the artificial that I said, you don't necessarily have to take out that tooth.
Okay.
What they do is just to shave it down a little and then they put an addition.
Oh, okay.
So there's a base support. So it's now that addition that you now choose the color as white as possible, snow white.
So if you have the money, it's something you can advise that you should do.
Yes, if you are so bothered, because some people are really, it affects their quality of life. So for such people, yes, to boost your psychology and your confidence. But for some, it's not so bad because for everything, there's always its side effects.
Okay.
Yes, for some, it's not so bad. It's something that can be overlooked. So for such mild cases, you can tell them, well, if you don't mind, you can just do maybe some topical bleaching at home. You can
Mm.
have some take home kits to do by yourself, or you come to the clinic to have some bleaching done. But even at that, you need to come regularly for maintenance,
Mm.
to have cleaning, then you get more kits. And the side effect of that is that you may have sensitivity, your teeth begins to shock.
Mm.
So that's why
Mm.
we tell you, if you have to weigh the pros and cons. If it's not so bad, just go with what you have.
If it is not so bad,
Yes.
just go with what you have. If you're
Yes.
listening to us today on the issues, we are talking about the World Oral Health Day. This is a day that has been set aside by the World Health Organization to create an awareness to the general public, and that is why a practitioner is with us here in the studio, putting us through this conversation. If there are questions at all you would like to ask our guest as regards your oral health now, that is the focus for today. You can call us on our studio lines 0904 1061 or 0904 1061. Dr. Mojisola Mati will be able to answer your questions, I believe. Now, let's move ahead to another problem of our oral health. You have talked about the color of the tooth. Let us talk about the smell now. We still have people that they will tell you that I brush my teeth twice daily, as recommended as it should be, right? But then there is this awkward smell that still comes. For you, what can you say? Why do people have the mouth odor?
There are different factors that may be responsible. For some,
There are a lot of factors to mouth odor.
yes.
Wow.
For some, it may be psychological, in the sense that they are the only ones that feel they have the mouth odor. Nobody has confirmed it to them, not even their spouse or their children. Children always say the truth. If you need to just meet a little baby, ha, what do you see? Ah, uncle, your mouth is smelling. Then you know that definitely
It is
true.
smelling.
Yes. But most times you're talking to them, you're having a conversation, and you can't even smell anything. So for such people, what we do is to just refer them to the psychologist, because they may be deeper issues.
They
And
just think in their mind that
yes,
they have mouth
usually
odor.
there are deeper issues going on with them.
Mm.
Probably, they are home, at work, a lot of issues associated with that. Then you have some people that genuinely they have that mouth odor. And that also, it may be as a result of having decayed tooth in the mouth.
Okay.
Yes, multiple, because that will be like a harbor for leftover food, which would decay there and cause mouth odor. Everybody has oral bacteria in their mouth. And what this bacteria feeds on are the foods that we eat, which will be converted to sugar. And once they feed on that sugar, their own byproducts, it's what decays the tooth. So you need to have a regular cleaning. That's why we encourage brushing twice daily.
Daily.
Yes. So that you reduce the amount of food content in the mouth. Because there's nothing you can do. The bacteria is present there. Therefore, some, it may be that they have some respiratory infections.
Okay.
Yes. Chronic cough, chronic congestion in the lungs, the throat. So, and I told you, everywhere is connected. So by the time they are breathing, that odor,
It comes.
it comes out. Yes, for some, it may be gastric problems. Yes, for some, it may even be as bad as cancer.
Wow.
Yes. So, like I said again, the mouth mirrors what happens in the body.
But then, are there ways to is this? Let's talk about the mouth odor now. Still on that, is it something that is curable or it can only be managed as it is? Is it something that
It depends on
which?
Yes, it depends on what is causing it.
Okay.
For someone that has probably a lot of bad teeth,
Mm.
definitely by the time you take care of those teeth and the person does the cleaning, the mouth odor should stop. For some, it's their brushing technique. They are not brushing right. Some people just brush, they ignore the tongue. And then the tongue harbors a lot of bacteria. When you see their tongue is white, you know that definitely this person is not brushing properly. So by the time they adjust their brushing technique, the odor subsides. For some, it may be some underlying medical conditions. By the time you run some tests and you discover that, you refer them to the proper specialist. Once that is taken care of, the odor subsides. But for the psychological ones, they just keep coming back.
They just keep coming
They
back.
just keep coming back. So that's when you know that there are deeper issues. But by the time they see the psychologist and they have conversations with them, they know how to get to the root of the problem. And you find out they're happy.
I see some calls are coming in. We will take in your calls right immediately after the next two questions. I want us to take this conversation to its zenith. I want us to take it to its peak now. It's an awareness, and it's important the general public are aware of all of these things one after the other. Now, let's talk about another assumption or myth, so to say, that there is this, you know, is it contagious, so to say, when there is exchange of lips? That is kissing, the commonest word that it is called, right, in relationships, either marriage and all. Are there any infection whatsoever that can be transmitted through kissing?
Yes.
Put us through that.
For example, recently we have an outbreak of
Mm,
diphtheria now.
true.
Yes. And it's a respiratory droplet infection.
Mm,
That means sprays from the mouth, saliva. If somebody sneezes on you, you get
mm,
it.
mm,
So your saliva
mm.
harbors bacteria. So if your partner, there's something going on with them, it can be transmitted. And then we have what we call crevicular fluids inside the gums. That
Okay.
also houses some microbes.
Mm,
So that also can be transmitted via kissing.
mm.
Yes.
Okay. The conversation can only get better. 0904 081 1061 or 0904 082 1061 is the studio line. Now let's look at the aged persons now, where usually there is this. I don't know if it's a bacteria. You'll be able to put us through that. But let's take this first call and see. Hello.
Good morning.
Good morning. Thank you for calling us this morning.
Well done.
Yes, ma'am. Digness
Thank
Ogubanjo.
you. Thank you so much.
Talk to us this morning.
I won't give that thank you. Well done.
Good morning, ma.
The thing you are talking about, first piece of first piece. If our pikin get it, we go see say na bad thing. She talk and so now. I
Okay.
don't know because the thing
Mm,
wey we dey pick is that if dem say that boy or lady call someone, we go feel so. But we
okay.
talk now.
All right, Digness Ogubanjo. She will attend to
Thank
that.
you.
Thank you very much, ma'am, for calling. I think what our caller there is saying is that the upper teeth for babies, like you said earlier, she's saying that there are even other sides to it, which is the side of they say if such a child bites you or something, you might be infected and all of that. So maybe you should just help clear the air with the upper teeth. Yoruba calls it in UK.
Yes.
Mm.
Usually, like I said earlier, it's a myth.
Mm.
The normal chronology for tooth eruption is that the lower one erupts first,
Mm.
but there's always some variations. Like I said, it may be minimal, but
Mm.
it does happen.
Mm.
Yes, for some, a very few minor percentage, the upper teeth may erupt first.
Mm.
But because it's not something common, they now attach some spiritual and some myths around it.
Mm.
But it is not so.
All right, you've heard it from Dr. Mati Mojisola. It is not spiritual at all, so you have nothing to fear, nothing to worry about. Dickness Ogumbanjo, that has been said to you already. Talking about aged persons now, I think it's more common with them. I think it happens to younger people too. But I want you to help clear the air on this one where, you have these pains and then they tell you to remove your teeth. You remove that one, it transfers again to another teeth. It continues like that, like that. What exactly is the situation? Is it that you have to, cut off that part of the teeth? What happens with situations where you just have to keep removing your teeth?
You just have to keep removing your teeth.
Mm.
I don't believe that.
Okay.
But when that happens, it's because you have not changed the habits that led you to removing that first one.
Mm.
For example, maybe your diet.
Okay.
Yes. If you're still taking sugary things, and most of our food here, unfortunately, by the time it's broken down, it leads to sugar.
Mm.
So you now need to adjust and take some healthier choices. If you
Mm.
don't do that, definitely another tooth is going to come down bad.
Mm.
Secondly, your oral hygiene habits. If you don't step it up or you're not doing it correctly,
Mm.
definitely another tooth would become bad.
Mm.
Like I said, there's a technique to brushing. If you come to the clinic, you'll be taught the proper way to brush. It's not just brrr.
Mm.
There's a way to it, to doing it.
Mm.
So when you come, you'll be taught. Then your toothpaste as well, it should be a fluoridated toothpaste.
Mm.
So that helps to keep your teeth stronger and to be able to fight the byproducts of the acids of the
Mm.
bacteria in the mouth, which are acid that dissolves the tooth. So that also happens. And then the fact that you removed one,
Mm.
and they will tell you there's a worm going around eating the roots of the tooth.
Exactly.
Yes, it is not true.
It is not true.
It is not true.
Mm.
It's just because they have not changed what is causing that.
Okay. Having said that, I think it is time for you to help the general public now, which is the essence of the day, to know how best to care for your oral health. What are the things we should do? What are the things we should not do? But I would ask this question again. For people that use chewing stick, what is your take on that? Some persons will tell you that this brush is not my thing. This paste is not my thing. Let me just use my ibile. Let me use my chewing stick. What do you have to say to that?
Yes, we don't discourage people from using chewing stick if you use
Okay.
it correctly.
Mm.
When I say correctly, when you get a chewing stick, you have to chew the end to make it bristle like. That means you make the edge appear like a toothbrush.
Mm.
And then, the fact that you're using chewing stick, we still tell you you should put some paste. That's where the fight.
On the chewing stick.
Yes, that's where the fight comes. But they'll tell you that the chewing stick is already medicinal.
Mm.
Uh-huh.
Mm.
But usually, your chewing stick is just an alternative to toothbrush. You should still apply some fluoridated toothpaste on that chewing stick.
Mm.
And then chewing stick tends to be more abrasive. That means the bristles are harder,
True.
yes, than what you get on a medium textured toothbrush. So most times, and then they are there applying so much force
Force.
while brushing.
Mm.
When you do that, you're causing more harm than good, because you are going to damage your gums. And once the gums are damaged, the root of the tooth becomes exposed, which is not supposed to be so, and it's not as hard as what you usually see, which is the enamel.
Mm.
The roots are softer than that. So once the gum is gone and the roots are exposed and you're still applying that force,
Mm.
it just takes a matter of months, and you see that you've already caused like a concave shape on the root of the tooth.
Mm.
If you still don't stop and you keep going, they will tell you, I was just eating bread and I heard pa. That means the tooth broke off.
Whoa.
Yes, it's because of that continuous abuse to the tooth.
Mm.
So also, when you're using your toothbrush, we advise you use a medium textured toothbrush.
Mm.
Some people believe the harder it is, the cleaner their teeth are.
Mm.
It is not so. It is the technique that really matters. Unfortunately, there's no way to demonstrate the proper technique here.
Mm.
Yes, but it is the technique of your brushing that matters, not the amount of force that you use to brush. Then, like I also said, you need a fluoridated toothpaste to brush. Once you have those two and you're doing it right, brush your tongue as well. I think you're good to go.
You have put us through how best to take care of our oral health, but we'll still hammer on that again because that's the essence of this day. 0904-081-1061 or 0904-082-1061 is the studio line where you can call us and ask our guest questions as regards this special day that has been set aside by the World Health Organization. Now, let us talk about the children now. These are people who cannot care for themselves by themselves. But let's take this call. Hello to you. Good morning. Thank you for calling us.
Good morning.
Thank you for calling.
Yes, good morning. Mr. Adimamo,
Yes, sir.
how far?
Fine.
Everything, sir.
Fine, sir.
My name is Biola from Produ.
All right, sir.
I greet our doctor.
Yes.
God will continue guiding her and giving him the truth to say every day. In the
Mm.
name of Jesus. Now about the tongue washing.
Yes.
Some people they use what they call it brush just to wash ordinary teeth, goes in and out, then they will leave tongue. After 2 or 3 minutes, it will smell. I said, why can't you wash your teeth tongue? They say, no. The doctor not tell them like that to the wash tongue. Now I don't understand. Maybe is it true to not wash the tongue in the morning? I don't understand. Can you mention the tongue now? This was saying supposed to wash.
Mm.
If the doctor say, make the wash out. So I know to know what is going on about it.
Thank you very much. He's saying that there is a situation where this person refuses to wash the tongue. And whenever they ask the question, why don't you wash your tongue? Says the doctor said they don't wash tongue. Right. So I think that's another myth, but then maybe you should clear the air on that particular one.
Okay, you should ideally wash your tongue after brushing, while brushing.
While brushing.
Yes, because your tongue harbors a lot of bacteria. So if you don't brush your tongue, even though you brush twice, 3 times a day, you're still going to have some mouth odor. And then once you brush the tongue, that decreases that mouth odor. And please, all these people that will tell you the doctor said, I'm sure it is not a doctor. It must be a quack that said that. So please, anytime you have any dental issues, please do not go to your roadside so-called doctor, whatever, and they tell you use this solution, apply it here. It works for the ear. It works for toothache. It works for if you have an abscess, just put it. Please don't visit such people. And then all those women also in buses that sell solutions. One solution will cure about 10 things. Please, exactly. Please see your dentist, because they are only postponing the evil day for you. Those solutions are too harsh. So what it does is that it causes severe burns in the mouth, and then by the time they are seeing us, it's even worse than what they had earlier on. And I tell them, okay, well, now why don't you go back to the people? Doctor, Emma Shemibe. I'm like, oh, really? So you know the right thing to do. Meanwhile, you've wasted time, you've wasted resources.
And it's now at a time that is almost too late.
Yes, and now you're coming back to us.
Let's talk about the brush before we talk about the children, the leaders of tomorrow. Our toothbrush, we read with the placard and the papers attached to toothbrush that it should be 3 months. There are some brush that they will say right 6 months. But which exactly? Is it 3 months, 6 months, 2 months, 1 month, or a year? How long are we supposed to use our toothbrush?
Ideally, you should change your toothbrush every 3 months.
3 months?
Yes, but it's not a hard and fast rule.
Okay.
Once the bristles starts to split, that means once the bristle starts to scatter, yes, you should change your brush. Then ideally also, once you have a major illness, you should change your toothbrush. Yes, because the mouth mirrors the body.
What at the point where you buy very good original brush and it's not scattering and it's over 3 months?
No, and it's not scattering, then please every 3 months change the toothbrush.
Because there are some kind of brush that you buy them. I have this particular brush, is so foreign, and to change that brush is.
Please change it every 3 months.
All right. The conversation continues. Let's talk about the children now. These are people that cannot care for themselves by themselves. How best can parents, guardians care for these children when you talk about the oral health? Can you put us through that?
Okay, like I said, as soon as the baby starts to erupt the teeth in the mouth, you should start brushing. And you should bring them for their first dental appointment, just for familiarization. We may not necessarily do anything, but at least they get more comfortable coming to the dental clinic. So in terms of brushing such children with baby teeth, there's what we call a finger toothbrush that they wear on their finger. And then you buy the milk teeth toothpaste and just apply a pea size. That means just very little, because those children will lick it off. They won't rinse out. So with very little amount of toothpaste on that brush, you brush both the outside and the inside, and then brush their tongue. Because you see some babies, they come and you have milk debris all over the tongue. It's going to cause mouth odor for that child. So they'll tell you monoglycerin, they are using this and that. Please desist from such. Buy the appropriate size toothbrush and paste and use on that child. Usually the milk teeth should suffice till about the age of 6 years. So after that, they can now start using what the adults use in terms of toothpaste. So for children above 6, you can use soft textured toothbrush for them. Yes, with the toothpaste that we are using. Yes, but also pea size. It's not from edge to edge. So
okay.
Yes, that way you're wasting toothpaste. Yes, just a minimal size. The technique is what really matters.
Talking about paste, I saw a story one time that a marriage broke up because of don't press from the middle, press from
the end.
But that is by this side. 2 more questions before we let you go. I want to thank you so very much for being a part of this conversation. It has been educative and fun at the same time. Thank you for doing this with us here.
My pleasure.
Let's talk about two other major problems. There are people that brush their teeth, and then while doing that, there is this blood, samples, a little bit of it. Sometimes it could be much, sometimes it could be little. What is the cause? Why do people see blood while brushing their teeth?
Is usually as a result of accumulated debris that has now calcified over time.
Please break that down. I'm confused.
That means you have dirt in your teeth that has become hardened,
Mm,
and then they usually appear maybe gray. It depends. Some appear grayish. I've seen some greenish ones. I've seen some blackish ones. It depends on how long that has stayed. And then some are so used to, they think that is the color of their teeth. But by the time they come, and usually that also causes mouth odor
okay.
because it's an accumulation of debris and bacteria, food particles, all sorts. Mhm. So by the time they come to the clinic and we do a cleaning for them, they're like, wow, is that from my teeth? Are those stones? Are you breaking my teeth? Because it's so hard. Yes. And some can be so bad that it covers the whole surface of the tooth. So because of that, the gum is very sensitive. Once you have such in your mouth, the gum reacts to it by swelling. We call it inflammation. And at the slightest impact, it's going to bleed. And that is what causes the bleeding that they see when they brush.
So it's not normal to see blood particles. Some people are already comfortable with it, like when they see it. Oh, it happens. Brush, so it's not a normal thing.
It's not a normal thing. Another thing that could cause it may be that they are applying too much force when they are
Some
brushing.
brush like they are washing their jean.
Exactly.
Wow,
Yes. It's not so bad. There's a technique to it. Then another thing may be the texture of the toothbrush. They may be using the wrong texture. So like it hard, it is not, hard toothbrush only damages your teeth. It doesn't do you any good.
Thank you for that clarification. Now let's talk about another one, which should be the last one so that we can let you go. Thank you so very much. Talking about salt now, we have people that will tell you that the same thing the paste will do is what the salt will do. So I can just brush my teeth with salt. Some will tell you, in fact, salt is more effective to brush the teeth. You are a medical practitioner. What can you say to that?
The salt doesn't do the same thing as your toothpaste.
Oh, really?
Yes, it doesn't. Because like I said, the toothpaste has a lot of components in it. You have the foaming agent, you have the antibacterial agent, you have your fluoride, which is what we advocate. Salt doesn't have fluoride, at least the salt in Nigeria. Abroad, you have fluoridated salt.
True.
Yes, but here in Nigeria, the main source of your fluoride is from your toothpaste. And once you miss out on that, you are doing your teeth a lot of harm. You're not doing it any good. So, and then sometimes as well, some herbal toothpaste as well do not have fluoride in them. So usually for those that like it herbal, please check the ingredients, the composition, and make sure there's fluoride inside. Then there's this belief that the more foreign it is, the better. 20,000 Nimora toothpaste here.
I think we have a call. Sorry to interject here.
Hello.
Yes, hello.
Good morning.
Morning, sir.
I'm Sam Innocent from Alabado.
Yes, sir. Good morning, sir.
In briefly, if I want to tell you the problem caused by ignorance and inefficiency concerning this kind of problem we are talking about this morning. One, the valuation of Naira produce substandard toothpaste, causing a lot of teeth problem for the people. Substandard currency produce substandard goods. That's why we need the valuation of Naira. Are you getting my point? Consider the implication of this health condition, health problem caused by this kind of substandard toothpaste. And the NAFDAC is doing their best, but they cannot solve the problem. So government needs the denomination of Naira so that they can get money. Spend. Are you getting my point? So they can have 49 billion trillion Naira. So spend the budget. Less than 10% of the money they want to spend in this year budget can only be available in the society circulation. Unlike the United States, you have about more than $40 trillion in circulation.
Good morning. Thank you for calling us this morning. Hello, good morning.
Good morning.
Good morning, sir.
My name is Andrew. I'm calling from Ofin.
Okay, from Ofin. How is Ofin this morning?
Well, Ofin is fine and good.
Thank you very much. Are there any questions for our doctor girls before she leaves?
Yes, I want to ask a question about my teeth.
Go ahead, sir.
Part of my teeth are falling. Then I want to replace it with another one.
Mm.
Because when I went to the doctor said you remove the remaining one, then in order to put another artificial one there.
Mm.
The remaining ones, they are not shitting, nothing happens to them.
Mm.
But I don't know why the doctor said you remove the remaining one. I just want to ask the doctor over there, why is it okay for me to allow him to remove it?
Okay, I don't know if you got that question correctly. Just stay with your radio set and she would answer to your question. Thank you. All right, so I think it's over to you.
Okay. It depends on the evaluation that the dentist he saw,
Mm.
the evaluation he made of the remaining teeth in his mouth.
Mm.
They may not be shaking, but there are other things that the dentist will see that he may not appreciate.
Mm.
So for him to recommend extractions of whatever teeth,
Mm.
there must be a justification for it.
Mm.
Yes. Then in terms of him replacing the missing ones, he
Yes.
has different options. We
Okay.
have the fixed appliances, we have the removable appliances.
Mm.
Even the removable appliances, it depends on the material that he wants to use. We have some that we call flexi dentures now, which are more flexible
Mm.
than the old rigid ones that used to be made.
Mm.
Then in terms of fixed appliances, we have your bridge, we have implants, which is the newest technology. For bridges, the teeth on the opposite side of the space
Mm.
that needs to be filled needs to be filed a little,
Mm.
and those will serve as anchors to hold it down. But for implants, you don't even touch the teeth.
Mm.
You just work with the space you have, and you sink in the implant into the bone. Once it heals up, then the crown will be placed on it.
So for him, he can go ahead with it. The dentist must have seen something.
Yes, before
for-
recommending him to remove whatever teeth.
All right, you've heard that you can go ahead and do the needful, just so you are fine. I think we were somewhere across the bridge before I lost it a little bit. But then let's take this other call. Hello to you.
Okay, good morning.
Good morning. Thank you. Morning, sir.
Yeah, this is Friday from Ikorodu.
Mr. Friday, how are you doing today?
I'm okay, sir.
Talk to us.
We are enjoying the program. We are learning, and we are also enjoying it.
Thank you.
Yeah. So I want to ask a question, but you've asked the question, the one that relates with the first issue.
Mm.
So the first one that I wanted to ask was, what about those people that did not smoke? They don't smoke. They don't. Yeah, they
Drink.
don't smoke,
Mm.
and they have maybe their teeth are not white like that. So, is there anything that one can be using that will make their teeth be white? Like a cream now that you put on your body, that you rub on your body. There are some cream that will change your color. That will
That will
make
bleach
that
your
will
color.
change. Yeah. So, is there anything apart from brushing your teeth every day?
Mm.
Is there a thing that one can use? I want the doctor to answer that. Is there anything that one can use like bleaching of teeth? So the second one
Just like the
that you
bleaching
asked,
of your skin.
yeah, exactly.
Mm.
So the second one that you asked
Mm.
concerning the thought. So I want you to ask the question. You said you have remaining two questions, so I wanted to wait to hear the question. So, but you asked it. So I want to ask now that can't one apply salt, including as in when you apply your toothpaste?
Still add
Can't
salt
you
to
add,
it.
yeah, can't you add salt to it? Because
Mm.
I know when we are small, we normally use salt
Mm.
to flush it very well. So can't one add salt to the one that you said he has fluoride? So
All
that is
right.
the two questions.
Thank you very
And
much. So this is what. Yes, thank you, Mr. Friday. Mr. Friday is asking a two-in-one question. Just like you bleach your skin, can you also bleach your teeth? If yes, how? And then secondly, he's saying just like you cook, you can add salt and then still add the maggi to it and still add iru locust beans, to just make the whole soup delicious. So to make the teeth more whitish, can you do salt and paste combined?
Okay, let me take it from the second question.
Yes, please.
In back in the days, I
Mm.
believe some people will even tell you they used to use charcoal. Some will tell you they break plates and grind it and that mix it with maybe charcoal, the fine powder of the broken plate and salt. All that they were relying on the abrasive nature of those mixtures.
Mm.
So is those abrasive natures that by the time it scrubs off the teeth, and then in the process you bleed a lot.
Mm.
Yes, you children then as you are brushing you are bleeding. How to for more than here? No. So that should sort that out. There's no need to add salt to your toothpaste. The toothpaste is already fabricated to solve your problem.
Mm.
So you don't need to add salt. Then on the bleaching matter,
Yes.
the color of your teeth, like I said, it depends on what is causing your teeth not to be white.
Mm.
If it's from extrinsic stains, by the time you come in for a scaling and polishing,
Mm.
you appreciate the true color of your teeth. But if it's an intrinsic stain, which S&P will not do,
Mm.
then definitely some of the options we give you is to bleach if you want.
Mm.
Yes.
If you want.
Yes.
How affordable is it to bleach a teeth?
It's not so cheap.
Aha.
Yes. It's not so cheap because it's not so cheap. And then bleaching also, it depends on how deeply stained that teeth is. If it's very brown, you can't bleach to have paper white. Yes, it's only going to take you like maybe 2 shades lighter than what you have. So bleaching, usually we recommend it for people who their teeth are not so bad. But if your teeth are bad, really brown, you will need some sort of covering over that tooth to give you the paper white effect that you're looking for.
Let's take this one more call. The calls keep coming in. Hello to you. Good morning. Talk to us real quick.
Hello, I'm the same person that called the other time.
All
I
right.
just want to, I heard what the doctor said now.
Mm.
When he answered my question, he said I can use light artificial.
Yes.
So he said there's hard one, there's light one.
Mm.
Then I want to know if the doctor is in Colombia. The doctor in the studio.
Okay.
Can she give me a number so I will call her? Then I will know what I want to ask him one or two questions. So how can I come to our place to get that soft one? Because many of the doctors here they will give you a hard one. They put it in your mouth. So that when you want to open your mouth, you find it very difficult.
All right. Thank you. We would attend to that one. Okay, that call is gone already. But then, this is the issues, and of course, it's in partnership with General Hospital Ikorodu. You can always come down to General Hospital Ikorodu, sir. You might not necessarily need the dental clinic. Maybe you should put us through what times will the dental clinic be available for people who will want to come down to General Hospital Ikorodu.
Okay. Our opening hours are Monday to Fridays.
Monday to Fridays.
Yes, 8 to 4.
8 to 4,
Yes.
Mondays to Fridays.
Excluding public holidays.
Aha, okay. So if you're there and you want to meet with our doctor, you can meet with her and any other trained medical practitioner at General Hospital Ikorodu Dental Clinic. You will be attended to Monday to Friday from 8 a.m. up until 4 p.m. Dr. Mati Mojisola, it has been a nice time with you here in the studio. In just 1 minute, what will be your parting words, your advice to everyone out there in commemoration to the World Oral Health Day?
Let's all take care of our oral health
Mm.
because the oral health is the gateway to the body.
Mm.
Please visit your dentist twice a week.
Mm.
Twice a year, sorry.
Twice a year.
Twice a year.
Mm.
Do not wait until you are not able to eat, sleep, or you have a swelling.
Mm.
As little as the tooth is,
Mhm.
you don't want to experience a toothache.
Mm.
Yes, it is so unbearable.
Mm.
So please do not wait until that time. We're always there to avail you any service you want. And please, the dentist is your friend because the way people paint us outside, if you go, malo, this and that, please, it is not true. They are very friendly. Visit your dentist twice a year. Thank you.
This is how far we can have it today on the issues here at IKD 106.1 FM. Don't forget that today I apologize. We will not be able to take in any more calls. I see the calls are coming in. Just go down to General Hospital Dental Clinic Department. They would attend to you there. This is how far we can have it, celebrating the World Oral Health Day, 20th of March, every single year. Thank you to our doctor guest, Dr. Mati Mojisola. Thank you so very much for joining us.
Thank you for having me.
I am Opayemi Adibambo. Until next week, Thursday, same time, same station. Remember, your health is important. Health is wealth. God bless Nigeria. God bless Lagos.